yellow color can be seen even without pus cells. Generally, we believe that yellow color is because of pus cells, the infection is there. Necessarily not. Even without pus cells also we can find yellow color. And then milky white, kapha dushti. For modern point of view, milky white is normal, but Ayurveda says it is abnormal. We have kapha dushti, where we have to go for again Triphala, Loha Bhasma, etc. can be given there. This is the importance of color. Then comes pH. As I told, pH is 7.2 to 8.5 is the normal pH. More than this, 8.5 is we have ruksharetas. The principle is same thing. As I told, takra is ruksha, the kerosene is ruksha, detergents are ruksha, where they will exert dryness over the on body surface or body activities. Likewise, this increased pH will exert reversal osmotic pressure on the sperms, and sperms cannot survive. So here we can give Shatavari or Vidari or Kokilaksh etc. can be given to decrease or minimize the pH. And particulate debris. In the microscopic examination, if we see, apart from the sperms, other cells, we may find just like dust particles we can find. So these can up to grade 2 up to +2, then up to normal is +2. We can have more than this is +3, +4 comes their maximum. That is totally abnormal. And these, apart from this, we have particulate cells, other cells will be there. Polymorphonuclear cells, then epithelial cells, etc. So those more than 5 is there all together. And then immunobed, that is anti-sperm antibodies. I am showing the patterns there. If that is more than 20%, any one of these factors, we have to call it as Anyadhatu Samsrishta. Then we can go for Virechana, is the best one. Again, Dashmula Uttarabasti can be given for the treatment of these. So then I will be showing the anti-sperm antibodies here. This is the pattern of antibodies. When the antibodies are present in the sperms, they will agglutinate each other. The sperms cannot move forward. They will be binded by antibodies. So here there are different patterns. This is the head to head. All heads are binded by antibodies. There will be clumping will be there. The sperms cannot move forward. And another one here, tail to tail. They have two types, tail tail, linear type and mosaic type. All tails are binded by antibodies and they cannot have motility and they can't go forward. And this is a mixed type. Head and tail mixed, it will be again mixing type of these ones. And this is a non-specific agglutination. There is a macrophage here and heads are binded with a macrophage. It is called non-specific agglutination. These are the patterns of agglutination where we can see because of antibodies, the sperms are binded it and they cannot move forward. So this is the surface antigens. Sperm and the head, these are the antigens are there. On the head antigens, this is the antibody in between. So this head and this head is binded by antibody, so it can't move forward. So it is called head-to-head agglutination. Similarly here, head to tail, mixed type of these ones. And then tail to tail. There is antigens on the surface and antibody production is there. So they will be binded together and there is a big clumping, huge clumping will be seen of the 50, 100 cells, sperm cells. They cannot move forward. And then presence of RBCs. As I told, very few injuries etc. you may find RBCs. The congestions here. Here Anida Samsrishta we have to call and Kudupagandhi. These are two conditions where we can find the RBCs presence will be there. One is Arunavarna, Krishnavarna, another Kudupagandhi. Both can be taken. The nomenclature. Generally, what is the normal values? The sperm count should be oligospermia, less than 20 millions count. The count should be more than 20 millions. That is a normal one. Less than 20 we have to call as oligozoospermia. And less motility we call asthenozoospermia. 100% immotile we call as necrozoospermia, 100% immotile. And then more than 70% abnormal forms we call teratozoospermia, abnormality. And then combination polyspermia, more than 250 millions. Even high count is abnormal only. More than 250 millions called polyspermia, abnormal. And then more than 5 pus cells, pyospermia. And then no sperms, azoospermia. And then absence of ejaculate, no ejaculation at all, which is called aspermia. These are the different conditions where you may come across while dealing your practices. To understand that one, I am giving all the different nomenclature I am giving here. Then coming to the different duct system, the passage system, how it has to be normal, the abnormal conditions, how it happens there. Now there is a production here. It has to be passed through the vas deferens and along with the seminal vesicular content, it goes to here. Ejaculated duct, the prostatic secretion adds here and again go to the here in between bulbourethral gland secretions. All together they join and came out of the tracts here. So here we may have one is obstruction agiospermia, there is obstruction somewhere, or vas aplasia, the absence of vas. The vas will not develop at all here. Vas aplasia, there is no vas at all. The only testis is here and there is no connectivity there, vas aplasia. And then retrograde ejaculation. While ejaculation, the bladder neck will close and these contents are expelled out, propelled out to the exterior. In some cases, the bladder neck will not close, it will escape into the bladder, the retrograde ejaculation. And then hypo or epispadiasis, the structural defects. The penis will have opening, abdominal opening at the bottom or on the top of the penis, not on the tip of the penis. So this is called again abnormality. So by all means, he may not able to ejaculate properly and there will be infertility may remain. And here in the obstruction, we generally have two levels, either at the vas or at ejaculated duct. These are the two levels obstruction generally happens there, especially in case of mumps architis or injury in case somewhere something happened to the vas deferens, it becomes fibrous, then becomes blocked there, or ejaculated duct, it will be blocked here, those ones. These two are the major classification of obstruction. When in the vas it is obstructed, the contents of this are not came out of that one. Remaining the vesicular, prostatic, all contents are there except the testicular. So there is volume will be normal, pH is normal, fructose is present, only sperms are absent there. That is called obstruction of the vas level. If here the block is there, so then what happens? There are no sperms, no subvesicular content, only the prostatic and bulbous gland secretions comes out here. The volume will be very low volume, pH will be acidic pH, no sperms, fructose is absent. There is a classification how we can easily categorize level of obstruction, we can be estimate that one. Then vas aplasia, again there is no treatment for it. I will be showing each levels. Then aspermia, the different agiospermias I am dealing here. Aspermia, this absence of ejaculate. This the person will not reach the climax. He may develop it, but because of not reaching the climax, he may not able to ejaculate at all here. So he may remain as agiospermia. Then vas aplasia, as I told, absence of vas. Then obstruction. Then testicular failure. All these remain as agiospermia. I'll give the management differently here. Agiospermia is, one is aspermia. We have to go Shukra Pravartaka Dravyas, Brihoti, Kantakara, etc. We have to accelerate and take the counseling to reach the peak of the person so that he can ejaculate well. And second one is then aspermia, Shukra Janaka, then here vas aplasia, no structure there. So we had to aspirate from the epididymis and go for insemination. And then obstructive agiospermia. Again, I have not succeeded. I have tried all panchakarmas, Uttarvasti in several ways. I tried it, but I accept only one case. There is again obstruction, then surgery was done, then there is post-surgery obstruction. In that case, I succeeded for only transient period, but there is no fertility, except that the very non-conclusive case, I have not succeeded. So I kept Uttarvasti as a question mark here. And then settled cell only syndrome. Few cases I have treated almost all panchakarmas and then Rasayana for more than 6 months, etc. Still, I didn't got any success in that one. So I kept panchakarmas as question mark. That way, future areas. And then maturation arrest up to panchakarmas and Uttarvasti and Shukrajanak Dravyas. Here we may get different levels of management. Results are there here, depending on the level of the maturation. Then sexual function is very important. Everything is fine, the tract is fine, he is producing everything, but he cannot able to ejaculate high in the vagina. One is lack of sexual desire. He don't have desire at all. And then erectile dysfunction. He have desire, but he don't get proper erection. Erection is there, but he can't ejaculate. And then the retrograde neurological failure. Even everything is there, but neurological failure of emission. He get orgasm, propulsion, but neurologically there is no propulsion of the contents from the tract. And then orgasmic disorders. By all means, the person may remain infertile. I am not dealing in detail of these ones because infertility only I am dealing today. Only in this one, we need to have sex education is a very, very important factor. In our survey studies, we noticed it. Almost none of the individuals are having properly educated about sexual activity, including ourselves. We never got a proper education of sexual education. Here I am just showing you an example. You are going and searching in the net. So what is how to sexual activity? And she came out with the frustration. Here shift, alter, shift, control, enter. At least now we can able to understand that which she is asking. with the computer language she brought over here, and then she is asking. The person is not able to understand what is sexual activity at all. The ultimate today is we have poor education system are there. We don't learn the systematically how to enjoy the sexual activity are there. Earlier there, Kama Sutra was there, and in the history we can find the kings used to send their sons to the sexual schools there. We can say the Vaishya Vatikas or the brothel houses that time. They used to send there where they had to learn the art of sexual activity and come back for this one. A methodical training was there olden days, but again we lost it, became taboo. Everyone want to enjoy it, but nobody want to come out of that one. Nobody want to talk openly about this one activity. We never had any proper education. Everyone who have improperly learned and going and practicing in under one misunderstandings are there. And then coming to the defects in deposition of rhesus in the vagina. How we can deposit. How much time is there? Okay. Then here defects in deposition of rhesus in the vagina. Apraharsha, sexual desire. Clibial dysfunction, the same things comes here. Ejaculatory disturbance. Vakri, hyporepispediasis, urethral pouches and phimosis. And then Vimarga Gamana, retrograde ejaculation. Here we have to examine in case of vagiospermia, if you have doubt in that one. After coitus, we need to collect the urine and examine. Then we may find sperms in that one. Then we say there is retrograde ejaculation. And then Baddha Shukra is obstruction, and Shukrastavata, Shukragatabata, and Apanavrata Vyana, etc. In such cases, we may have again ejaculatory disturbance are there. Shigrachuti and Dirgachuti, etc. are there. But very difficult to classify all those terms in actually in practical point of view. Literary meaning can be given, but in practically to demonstrate on the patient is very, very difficult each condition. And coming to the knowledge of fertility, generally we have a practice of when the infertile couple comes, we prescribe the treatment and we say these are the dates we need to have copulation. Earlier in starting my day practice days, I used to do the same thing only. I tell the dates, these are the dates, so you have to have compulsory intercourse on these days, compulsorily. Later on, some patients educated me themselves. They told, sir, you are giving the dates, we are marking the dates, and because of tension, we are not getting erection at all. On those days, we could not able to enjoy at all, we could not able to intromission, we could not participate in sexual activity because of anxiety is there. And females are forcing them to have intercourse very mechanically. They want to have children issues and say, for husband, you go for intromit and inseminate. That much only. They don't have, sexual drive is not there. So later on, I understand from the patients only, they educated me. Then I thought, better not to give the dates for the patients. Even the patient come with the dates, then I say, you forget now, I am giving the treatment to you. You try to enjoy life whole month, not to bother about any specific dates. Every alternate day or every now and then, wherever you get the sexual mood, you try to enjoy the life, sexual life very well with methodically and systematically with the good involvement. That way I used to encourage them. In between, they may conceive and come with the positive results. And then my message is better not to give the dates to the patients. You encourage them to have good sexual life. Otherwise, there is mechanical participation. Sometimes the failure is there. Then external factors. Apart from this, as I told, varicocele, then dietary nutritional habits. Varicocele, all of you know that one, there is pampiniform plexus, which is meant to cool down the blood which is passing to the testes. It is being not cooled down because of there is varicocele formation, varicocele is there. There are three grades are there, grade 1, 2, 3. Grade 1 is subclinical, which can be diagnosed by Doppler study. Grade 2 is the palpable varicocele. Grade 3 is visible varicocele. So whatever the grade may be there, but if the testis size is normal and the consistency is firm, then you don't go for any surgery. You can go for your Ayurvedic management. If the testis become smaller, atrophied, softened, then you need to go advise them for have surgery, and then you start your Ayurvedic management. You get the better results because it is already damage is severe. You cannot prevent it with medical management. Better to go for surgical intervention and then go for your medical management. Then combined factors, as I told this one, the maturation arrest or affection. Between male and female, they should have affection. They should not have only the mechanical participation. They should have affection. And then coital posture is very, very important. Sometimes we need to show the sketches for them, how to participate, which is the posture them. I have few conceptions by only correcting the posture. They don't have proper posture. So then antisperm antibodies, as I shown already, and even female will produce antisperms. and then lack of affinity between the gametes. This I observed is in the first year, 2 years of marital life, there is high fertility. You also might have observed among your relatives, everybody, everywhere. In the early part of marital life, there is high fertility. Later on, it will decrease there. So the gametes also will lose their affinity towards each other. There is a reason even in the first year of marital life, even the count is 1 million or less than 1 million, there is fertility, there conception. After that one, even 100 millions are there is no conception. They lose their affinity. So in that case, sometimes I used to practice brahmacharya. I say, both of you live separately and don't go for intercourses in between, so that you can get attraction. They'll develop attraction towards each other. That way we can do it. Atmaja Bhava, as I told, unexplained infertility. Among everything is fine, all tests are positive. There is no point we can say that there is a problem is there here. Then we have to think of unexplained infertility, Dayopasa Chikitsa here. So we need to consider Dayopasa Chikitsa at this time. There are many temples, yesterday even Dr. Ramdas was telling, Dayopasa Chikitsa in one temple, skin disorders. Likewise, there are temples meant for fertility. Even other day in Kerala there is Munnar Shala near Kotta, Kollam, there is also there. Likewise, there are many temples are there in throughout India meant for fertility. People go there, take holy dips or pujas, etc., holy rounds, etc. Then they'll get sometime dream, some sadhu came, somebody came, given a fruit, etc. The very next cycle, they'll be conceiving. Like it happens there. So we need to consider all those factors in the such conditions where unexplained infertility is there. The only problem comes here, some couples are not interested to go to the astrologer or temple. They say we don't believe in that one. Then what to do it? Then what I say is, you pray God on behalf of them. So you take the fees from them, you put into the God hundi only, but you can pray on behalf of the God. That is only we can do it. So next, the approach. In general, broadly I am giving the approach here. One is assess the sadhya sadhyata, as I told. Alpa and Kshina, etc. have given that one. So those factors we need to consider. In case of Bija dosha, Alparetas, they have very poor prognosis is there. Where Kshina, etc. we have good prognosis. So that we have to consider. Then classify them in Santarpanajanya, Apatarpanajanya. Whether he has Stula or Krusha is there. So Brahmana or Kashalana treatment, broadly we have to go for it. Then plan for Shodhana or Shamana accordingly. Then when to consider Shodhana, Panchakarmas. Very low parameters, OAT syndrome, that is oligoastrocytospermia syndrome, and positive family history. The parents have delayed conception or miscarriages, etc., or siblings have some problems on fertility. So such conditions, better to consider Panchakarma. Then those people are obese, very obese, and then Anida Samsrushta, Virechana has to be given. Then systemic disorders like allergy, etc., because they are prone for anti-sperm antibodies. In such cases, you select for Shodhana procedures. Then go for treatments. Some of the success stories or some data I will show here. Oligoastrocytospermia, as I told, these are very conditions, commonly you will get it, but very poor response is there. So I am showing here. What are the cases I have treated? Generally I will follow the family history, the delayed conception or miscarriage, etc. It may be positive generally. And then the clinical examination, atrophied testis, very small size testis, less than 15 ml size. And then poorly developed secondary sexual characters, thin and lean body, less body hair, less moustache, etc., no musculature much. And then semen examination, low volume, high viscosity, sperm count less than 1 million, low motility, increased abnormal forms. This is the picture where we can see in the case of OAT syndromes. Generally what I give is Vamana Virechana as suitable to the patient. I will go for it. Then first Nepan, etc., Google Tikta Gruta or Panchatikta Gruta I will generally select it commonly. And then Balashugandha Taila for Abhyanga. Then Madanapalla for Vamana and Trivruth for Virechana. Very common drugs I am telling. And then Kala or Karma Basti will go it. Among the Bastis, Vrisha Basti or Brahmana Basti or Yapana Basti, Lekana Bastis will be selected. Then we will go for medical management. So what happens after doing all these treatments, the OAT syndrome cases respond very slowly. You may not get very good encouraging result. Very slowly they will respond. And then the sperm count may increase up to 5 millions and suddenly falls again to the 0 or 0.01 million, or only for 20 fields you may get one sperm only. Likewise it may again fall down. Again it may for 6 months it may grow, again fall down. Likewise there is a trend in this, such cases. And sometimes there is a conception occurs, but it go for miscarriages. So Charaka says, It is Sukradushti, it won't conceive. If conceive, it won't retain. If retain, it will be disfigured. That way it says that one. So here, it will not be, generally it will not be retained. Success rate is less than 10% in my experience. We have doing all the procedures there. In case of agiospermia, these are the around 28 cases registered. In that, under further evaluation, I want to go for biopsy. Without biopsy, we cannot able to pinpoint diagnosis there. Just like go for biopsy, then go for management. In those cases are only 14 cases. And then, in that case, obstruction is one. And then, central cell only syndrome, in the absence of germ cells is one case. And maturation arrest is 12 cases. Among us, hypo or spermatogenesis 4 and complete maturation arrest 8 cases are there. In that one, those who have gone at least more than 3 months of treatment, those who came, they only considered, and about 6 cases are there. In that only 2 are where we got the sperm count. Again, one is the conception, one is not conceived. This is the how among the 28, I got only one conception, the agiospermia cases. Uttarabasti is Sushruta has well highlighted Uttarabasti, and in my experience, I have given several combinations of Uttarabastis I have tried, various combinations, and various analogical. Apart from infertility, I also given on urological cases, especially in case of hydronephrosis I have given. And then up to less than 10 ml to 250 ml range, I have given almost several Uttarabastis. Again, starting from Thaila to Kshirapaka, also I have given Kashaya, Kshirapaka, wide range of medicaments I tried for Uttarabasti. The regimen generally I follow is, if the patient is of OPD level, he comes and goes. First, second, third days I will go for Niruha Basti, then Uttarabasti I will go for 4, 5, 6 days. This is the way I follow it. Again, repeat after maybe 2 weeks or a month, depending on the available patients, etc. And in case of patient can be admitted, he is a non-localite, he want admitted, then we will go for morning Niruha, afternoon Uttarabasti. Likewise, 3 days I admit the patient, I give the Uttarabasti, the administer the Uttarabasti. Then in the agiospermia cases, what 5 cases I treated agiospermia, 1 is necrogeospermia and 4 agiospermic cases. Among us, this is the liquefaction time, almost the same, there is not much change. Viscosity, there is not much change. Then volume has a much improvement is there, more than double volume by third sitting. And pH, almost same normal. And sperm count, it was 2.6, it came to 16 millions at the end of the third sitting. And motility, it was 0 motility with all these ones. We got 14% of motility, third sitting is there. Anencephaly, case without head, twice it was born. Anencephaly case, a third conception, infantile death was there. It was born, but it was again death was there. Here we have given the both male and female. Given was panchakarmas was given. Karmabasti was administered. Then combination of Swarnabhasma, Rajita, and Divangabhasma, Shunti, Kapikachu, Estimadu, and then Bhalataka, Vati for the nearly 6 months we have given the varied conditions. And then female partner was managed with Vamana Virechana, Uttarabasti with the Palagruta, and then Medohara Vidanga Loha. She was very obese, I have reduced the weight, etc. And what happens? After a month, sexual abstinence. So I have prevented the brahmacharya was practiced with them, and then I allowed them for a coitus. Actually, I selected here the female. I wanted to have female baby only there because I want Asidhatu, the head was not born out totally. So I want to prevent the male birth actually. I planned for in such a way female patient. It was born similarly only. Then allowed for coitus. Then Vagbhadokta Masamaska Paricharya was followed. Then we have through LSCS female was born. I followed almost around 5 years or so. Even now they'll call me in between and give. The baby was absolutely normal, fine, very fine. So the phase of pharmacovigilance cases, adverse drug reactions, will be giving Vidari Kandam, the Priya tuberosa. This should not be given in the males. It's totally contraindicated. It is highly estrogenic. We should not give in the males. In my one of my junior has started a PhD study on this one, MD studies. When he has given 3 patients at a time, the 3 of them has got gynecomastia. It took nearly 3 months for us to reduce the gynecomastia. So it is highly estrogenic. We should not give in the males. It's very difficult to reduce the gynecomastia. And even at 500 mg level, it is causing adverse reactions. Another one interestingly I noticed it, one the central cell only syndrome, absence of germ cell case. I given Panchakarma, then for Siddha Makradwaja I was giving, then there is a rapid fall of WBC count when giving Siddha Makradwaja. The very rapid, twice has happened that one. Patient was given Siddha Makradwaja, it has gone down lower levels and then withdrawn. He was actually taken to ICU, then again revived it, come back again. Second time again he started it, again it has fallen down. This is also the reason we don't know anyway. Only one case after Panchakarmas, I want to give where Shukra, Janaka only, Siddha Makradwaja has given, very adverse reaction in one case. Then Avrishya drugs. We do have maybe Sarpagandha, Gugulu, prolonged time, Lavana, there are told us Avrishya. What is the role of Avrishya drugs? One is, we need to advise them, patient not to take more in quantities. There is another advantage I found with that one, is in the practice as it is useful for the practice also. Once I had one maybe elderly person, around 45 years of age person, came to me and asked me, is there any medicine to reduce the sexual desire? I was surprised. Generally people come and ask us how to improve sexual performance. He is asking how to reduce it. I was surprised. Then he told he had one son of mentally retarded son he is having. He don't have much discrimination etc. He is troubling his own family members with this high sexual desire. Then he is being a father, he want to control all these ones. He came to me. Then I realized, okay, there we can have role of Avrishya drugs. So that time I prescribed Sarpagandha. Along with that one, even people also given, Gugule also has given that one. It has worked out well and able to reduce that one. So we do have, apart from the advising, there are certain areas where we can use this actions also. With this with the slogan, always be rapid, progressive, motile, the super sperm, the new next days. I thank you all for patient hearing.
Now paper is open for discussion. You are free to ask any queries and questions.
What will be the success rate in male infertility out of 100 patients?
25%.
25%. Thank you. Which type of causes are more responding?
I told Sheena only. Sheena Retus. Alpha, very poor response. As
People with hormonal abnormalities?
They also responding with the Panchakarmas.
People who are having minimum possibility of spermatogenesis in testicular biopsy, what will be the outcome?
There are the OAT syndrome cases less than 10%.
Okay.
The success rate.
Okay.
Most of the miscarriages. If you have planned conception, then you have good outcome is there.
No, whether they can be directly conceived or they require
most of the times what happens, patients are in a hurry to conceive. We advise them, till you don't go for conception till my advice. Still they have conception, that land in the miscarriages. Whereas if you have combined evaluation, in the postcoital test you are confirmed very nice, then you have planned, then the outcome will be very good.
Okay, thank you.
A FSH raise, it indicates testicular failure. It is from hypothalamus there is stimulation, and then the testis is not responding, then there is the more stimulation. The way you are calling some person, he is not responding, you shout more. Likewise there is a more stimulation from the hypothalamus, and testicular failure is there. So then we need to, that we also call as our avarana also, we can take it as avarana also, under avarana. But anyway, depending again, Reto Dushti, general features, we need to come back to Ayurveda. Then if it is obese, we go for Vamana or Virechana, etc. Likewise only we need to treat it, that will become automatically normal. Because we need to produce here, the feedback will be normal only.
Sir, is there any possibility for testicular regeneration, sir?
Testicular?
Regeneration. Suppose some mumps or something might have had.
Mumps it will have.
Sir.
Again, the reversibility all get less than 10% only.
Okay.
We cannot estimate by biopsy only. This hypospermatogenesis is there, we may have less than 10%. Maturation arrest up to spermatid level, we have good response. Primary level, very poor response. Secondary level, somewhat better only. If spermatid level is there, we will get a good response. Biopsy will confirm our prognosis through biopsy.
What are the suggested drugs, sir? Mineral drugs or something?
Again, depending on the general condition, we need to go for Brahmanal treatment. Then Sukra Janaka one. I will go for Virechana, generally Virechana or Vamana. Then followed by Basti. Then goes for these Sukra Janaka Pravartaka drugs, depending on the viscosity, pH, etc. Those ones. Maybe Ashwagandha, Shatavari, Kapikachu, in the combinations of these, depending on pH and viscosity.
What will be the possibility of add-on therapy to the existing infertility clinics?
Add-on therapy, generally I'll stop all my other medications which are all going on.
No.
Then-
As if my intention is that so many advanced techniques are there to create artificial babies. Suppose if we use our techniques and if we go for artificial techniques, at least the success rate of fertility may increase. Still they are claiming it's only 20%.
The 20% also high, because these cases are rejected cases coming to us, not a primary cases. Most of the cases are gone to allopathy, even IVF failure, they are coming to us.
No, what I am asking you is, suppose instead of sending a patient directly for IVF, if you subject the patient for Ayurveda treatments and then if you send for IVF and other things,
That also
any such type of collaboration happened?
No, I propose with many of the IVF centers, especially Garbhastapana, as I told, super sperm concept. I'll say we can inaugurate good sperms and then you can go for fertility. But we could not collaborate with them. So far, no trials has been carried out in that fashion. I'm
Okay.
trying to pursue it.
Okay, thank you.
Sir, there are four types of clibia told by Charakacharya. One of them is Bija Upagatajam. You said Bijam is actually the spermatozoa, and the Shukra Dhatu is only the seminal fluid which is protecting it. So, have you seen any correlation between erectile dysfunction and less in number of spermatozoa or Shukra Dhatu?
So there is
direct
confusion among
correlation.
the Bijopaghataja here. That Bijopaghataja is, when you read the description, that is after birth, that is some other nidana it is causing in the individual. He has not, his genes are not defective before he born it. Actually, he got the mutations which may, next generation may suffer it, etc. And that it may be in the form of hormonal secretions, etc. It may be there. But a lot of confusion is there in that one, Bijopaghataja. It is after birth only. The Nidana factors told is after birth only. It's not before birth itself. So I also have a lot of confusion in that one to attribute the genetic defects just like insulin secretion defective. Likewise, the hormonal secretion will be defective in such case, where leading to the clibia. That may be taken that one.
Sir, one more question. We talked about retrograde ejaculation. This retrograde ejaculation, the treatment can't we see from a point of view of Shukra Meham? Any Prameha treatment was given to patients where it stopped the retrograde ejaculation?
No, I have not got any case actually. Only incontinence we got it, after bladder incontinence, etc. We given with Uttaravasti, we got very good result in those cases. But this one we didn't get it. I thought Uttaravasti will be very helpful in such case if at all we get the ejaculations. We definitely get with that one.
Thank you, sir. Any more questions?
Sir, I have two questions to ask. One is, where do we employ Shukra Janaka and Shukra Rechaka? Like, how do we clinically differentiate that? And one more question was, you had suggested Gugulu Tiktaka Krita Snehapanam for Virechanam. So I want to know the yukti behind that, sir.
Yukti, very commonly only I am giving that one. There is no very
Because
specific yukti
generally
I
it
give.
is said for Majja Astigata Vikaras, no? So that's why I was...
So Majja is the precursor, not this one. That is the only reason, one way. But here, when you, the first question you want to ask is...
Sir, first is how, like in which clinical case we can employ Shukra Janaka
Shukra Janaka
drugs
and
better
Rechaka.
and Shukra Rechaka
As I
better?
told, whereas Apraharsha is there, and where there is a ejaculation espermia, there is not ejaculation at all. Such cases we go over Shukra Rechaka actually. Whereas Shukra Janaka Dravyas, again where there is hypospermatogenesis is there, oligospermia only, again depending on the other features. Viscosity, pH has to be seen, viscosity. Those drugs can be selected, maybe Ashwagandha is there, Kapkachi is there, and then Shatavari is there. Those drugs to be selected according to the other features of this one. All are Shukra Janaka only, including Amlaki. So where to select which one, it gives the others Reto Pariksha Bhavas. That can be taken into consideration.
I will call upon Dr. Arvind D for give away the memento as a token of love.